Okay, so let's talk about good day, everyone. Let's talk about the gross anatomy of the skull. Okay, the skull is made up of 22 bones, excluding the ear ossicles. All right, and these are divided into cranial bones and facial bones. Uh, the cranial bones, there are 8 in number. They form the vault and base of the skull to protect the brain. We have the frontal bone, which forms the forehead, the roof of the orbit and anterior cranial fossa, and of course contains the frontal sinus. We have the parietal bone, which of course there are two, form the sides and roof of the cranial vault. We have the temporal bone, also two, located laterally. The important features of the temporal bones are the external acoustic meatus, the mastoid process, the styloid process, the zygomatic process, and so they house the structures of hearing and balance. Then we have the occipital bone, which form the posterior skull and parts of the base. It contains the foramen magnum, the occipital condyles, of course, which articulates with the atlas, that's the bone of the neck. Then we have the sphenoid bone. This is nicknamed the keystone of the cranial floor. Okay, so this bone contains, if I can remember, it contains it contains the sella tussica. If you check your text, the tela tussica houses the pituitary gland. Okay, it also contains the optic canal, the foramina rotundum, and of course foramina oval and spinosum. So there's also another bone called the ethmoid bone. This one is located between the orbits, between the two eyes. All right, it contains the cribriform plate, that is the olfactory nerve passage. Contains the crystal galli and part of the nasal septum. Then we have facial bones, the bones of the face. Okay, there are 14 in number. They form the face and support the oral and the nasal cavity. We have the maxilla, 2 in number, forms the upper jaw and part of the orbit and of course the nasal cavity. It contains the infraorbital foramen. Okay, now we also have the zygomatic bones. The zygomatic bone, they are also two in number. Form the cheek prominence. The cheek prominence and the lateral wall of the orbit. And then we have the nasal bone. They are also 2 in number. This nasal bone form the bridge of the nose. Then we have the mandible. This one forms the lower. This one is the maxilla. This one is the mandible. The mandible, forms the lower jaw, and that is the only movable bone of the skull. Because the mandible you can move. Okay, it has different parts. All right, it has a body and it has a ramus. Okay, so when you look around, it contains the mental foramen. It has the coronoid process. It has a condylar process, of course, which forms the temporomandibular joint around this axis. Okay. Then we have another bone called the lacrimal bone. They are also 2 in number. Small bones on the medial orbit. The lacrimal bones. Then we have another one called the palatine bones. They are also 2 in number. Form posterior part of the hard palate. Then we also have another 2 called the inferior nasal concave. Okay, form part of the lateral nasal wall too. Then we have another bone called the vomer. This vomer, forms the posterior part of the nasal septum. Remember I said that the inferior nasal concave form part of the lateral nasal wall, for a part of the lateral nasal wall. Then the vomer itself forms the posterior part of the nasal septum. Now, there are landmarks on the skull for identification. Okay, very important landmark on the skull. There's a landmark called the therium. it's a weak area where the frontal and the parietal, temporal, and sphenoid bone they meet. Injury here is very, very important because once an injury occurs here, it can rupture the middle meningeal artery. Okay, it can rupture the middle meningeal artery, and then a problem. So then we have the foramen magnum. Foramen magnum indicates the area of the medulla and the vertebral arteries. Okay, then we have the jugular foramen for passage of cranial nerve. We have the optic canal. We have the carotid canal for the internal carotid artery. Okay, so these are important landmarks, important aspect of the skull. Then let's talk about the gross anatomy of the cervical bones. That's the neck bones. There are 7 cervical vertebrae. That's the C1 to C7 that support the skull and allow a wide range of movement. Okay, the general features of the general features of the cervical vertebra is that it has a small body. It has a large triangular vertebral foramen. It has a transverse foramen for vertebral artery and the C1 to C6 nerve